Can you hear me if I talk loud? Because I kind of walk around a lot when I talk.
We got you.
Good? Good enough. Okay. I thought maybe that's why we had a full house, that he said Jimmer was going to be here. So I expected this and stuff on that. But no, he's actually in New Jersey right now. We're crossing our fingers that he'll go high and give the university back some of that money he's going to be making here in the next couple days on that. But no, appreciate Mark having me on. I think I was kind of by default. I'm the one that got stuck here. Should be in New Orleans right now at a convention, kind of like yourselves on that, but we've got a basketball camp going on with 400 kids. So if you don't want to go up to Salt Lake, you want to just photograph a bunch of 12, 14-year-olds, we'll be at BYU today on that. I do have handouts in the back. There's 100 of them. You can pass them out as you go. You can just take them on your way out with that. But what I want to kind of talk about, I don't have a clicker, so Jaron, I'll just give you the go ahead on stuff. Is just give you kind of a quick anatomy on some of these things right here. Some of you guys might have taken anatomy way back when. Some of you probably farther than that, but the spine has not changed on that. But I'm going to talk about a little bit about the back as well as about that. Yeah, this is how you wish your spines probably sometimes looked right now. Maybe sleeping on some of these beds, it might be a little more straighter and stuff, okay? But this is basically the anatomy of the spine, okay? The issues that I think, and again, I listened to your giveaways, had no idea what they were on that, and I translated some of this to the athletic injuries because I've seen you guys. I've seen you guys lug around the stuff you have to lug around in and out. I've seen Jaron jump from one side of the gym and the other side of the gym in less than seconds and lay in all different kind of poses. And Mark all of a sudden is here and the next thing he's there. And so I definitely understand the injury side of that. Okay? But with our spine, we have basically two types of injuries or two types of stresses we put on. Or really three, but the two that we worried about. We have the compression, okay, with basically just the weight that you guys have to carry around, both anatomically, okay, and with the luggage, okay. The second thing we've got to worry about right here, okay, we'll talk about that. Hey, I'm the same way. I understand how that freshman 15 stays on, and next thing you know, you get the 40-40, and then I'm hoping I don't get the 50-50. But with that, the other thing we worry about is what we call shear forces. Okay, so when our body flex, it will sit there and put the compression, not only the compression, but the shear force on what we call the discs and the different ligaments and stuff on that. Go ahead and hit to the next one. Okay, and that's when we have these discs right here. This disc is basically made up of a jelly-like substance. Okay, I don't have a pointer right here. And then we get kind of the outside of the donut right there. But when we put those, and then you got a bunch of ligaments, and this is just anatomy you don't need to know about. But with these disc spaces right here, when they get compressed, and you guys are in that forward position where you're reaching over, picking up a bag, and not in your, remember the spot that they probably all taught you, okay, lift with your legs, not with your back. But when you get that forward flexed position, okay, and you start putting on some weight, I went to try to pull up a slide, but they wouldn't let me. I think it was patented in this little calculator thing on the internet. Basically, it was saying if I was to pick up 45 pounds of weight, you could have up to 700 to 1,200 pounds put on these lower discs, which is basically what we call that L5, S1 disc, which is most of the flexion in your back is that low back. And that's basically where that belt rides of your shorts or pants. And so just a 45-pound thing, I don't know how big. I try to Google a little bit how much these cameras weigh, and I don't know, have any idea what you guys are using. But I'm guessing some of these bags have got to be 40, 45 pounds pretty easy on that, okay? And so just a 45-pound bag will sit there and almost 200 times put that same pressure on the thing. So now put that in with picking it up as well as a rotation force or a shear force on that. That's when you guys get injured. That's when you have those ongoing problems. Go ahead and go to the next slide. Hey, this is just the makeup of just how much muscles are in the back. When you sit there and say, I strained my muscle, you know, and you look at it and say, well, that's why it takes a little bit to kind of determine what area you're talking about. There's multiple muscles in the back with that. And so we deal with not only the bony abnormalities, the disc, ligaments, and muscles. Those are basically the four components, as well as with those nerves that will sometimes get compressed by these different muscles as well on that. And so that's kind of the anatomy of the back real quick. Go ahead and go to the next one. We have basically alignment issues, okay? You can look at that right now. Go stand in front of a mirror tonight and see which one you are, okay? We all have these things we can't really fix or correct. This is just part of it's genetics. Part of it is over time. Okay, a few of you guys kind of sit up a little straighter right now, trying to get that good posture, get those hips below the spine, so all of a sudden, you know, we don't have that sway back. And you can sit there and see if we just have that huge, what we call a huge lordosis, okay, in our back and have that big old curve, and all of a sudden now we've got to carry some things on that. That's basically going to make the big difference as far as what type of pressures, what type of compression forces, and what type of shear forces are basically put on that back. And basically the same thing with these different alignments. All right, go ahead, Jeremy. Go ahead and just click on the thing. So I've kind of just picked up and just said, okay, what are some of the risk factors that you guys kind of take on with that? I had a video on it. I couldn't download it. LSU game. It's all over the internet. Camera girl sitting on the thing. Guy tackles the quarterback, pushes him out of bounds. She just gets ripped. Flips, and her friend comes on and gives her a hug, and she's dazed on that. So obviously the impact. As an athletic trainer, I'm pretty safe on the basketball court because I'm on the sideline. Football is not a great spot to be at and stuff on that. Okay, end range. End range is basically saying, okay, I've slipped and fall, and if this is my normal flexion because I'm 42 years old and I can't bend, and all of a sudden I slip and fall, and then I'm really, really forced into flexion, that's what we call basically end range loading on that, which is not a good thing. And then what I think most of you guys deal with is just basically the lifting and the posture positions on that. You know, what I've seen and what I've been able to tell on that, you guys can be anywhere at any time, cramming, laying down, sitting up, leaning over on that. I've had the opportunity to look at 1 billion different pictures, and I appreciate you guys because all those cool pictures we get to see of the injuries as an athletic trainer, you know, you guys are able to capture and stuff on that. I could have got some really nasty and gnarly pictures, but that wasn't the issue on that. Rotational loading, okay? The twisting, okay? All of a sudden you're coming over there, you're picking up a bag out of your car, and you sit there and twist on that. That's kind of a big, big no-no right there. And then anything prolonged sitting, okay? At least I know basketball, they will sit down at a half-court side, and you'll sit there and you'll be there, because if you get up, what's going to happen? You'll miss that shot that you wish you had and stuff on that. And so sitting there for an hour at a time or half time, getting up, maybe doing some things and going back down. And sitting is probably one of the worst things you can do for a back on that, but yet we all do that. Okay, go ahead with that. Just talking a little bit on the low back, this is just kind of an MRI of a non-normal herniated disc. Okay, right here, this is our spinal cord right there. I would guess right here with this population in the room, there's probably 60% of us that have a herniated disc. It might even be higher on that since the mean age here I'm looking is probably about 40. Okay, and that's normal. That's just wear and tear. Whatever we did as a young age, whatever we've done as an old age, okay, we eventually get to a point where our discs will become degenerative and you get that low back pain, that just sharp pain that sits in the middle of the back. It might even go down to the buttocks, down to the back pocket. If it's going down to the hamstring or down to the calf, then we're in a lot of trouble, meaning it's a lot tougher to repair and stuff on that. The sacrum picture right here, okay, I have this right here. We have what we call the SI joint. If you've ever been to a chiropractor and he says your SI joint is out, I've got this kind of hip pain that's just off of my crack right here, okay? And you just got that sharp pain where you just feel like, gosh, something's got to pop, okay? That's just what we call a sacroiliac or an SI joint dysfunction, meaning that one of your hips is rotated due to basically what you're doing with that torsion and that twisting on that, getting in and out of cars, picking up and lifting out of things on that. And when you have that SI dysfunction, that makes your leg length off, and next thing you know, you just got that sharp pain that's basically sitting right here in that back pocket type. They're just above the back pocket, just below the belt right there. Okay, and that's what we call an SI dysfunction right there. And those are some of the common ones that I think that some of you guys go ahead and have. Go ahead and flip that. Okay. The congenital abnormalities is just things that, you know, what you're born with. You might be born with the fused vertebrae. You might be born with the long torso. You might have had the opportunity to have an extra few pounds on that. And those are things that, you know, we can adjust for, but we can't really make up. And you adjust for by basically taking what the Lord has given you and making the best of it and stuff. And so with different stretching programs, strengthening programs is what we try to implement to our athletes. Okay. Unfortunately, once we're not considered athletes, we feel like we don't need to do that anymore. Okay, then we have the recreational golfers, the recreational basketball players on that we still have that. The poor body mechanics. I mean, that's the given right there. Okay, we all have not very good mechanics. That's why we have so many chiropractors. That's why we have so many physical therapists. And in my behalf, that's why I'm able to sit there and still stay in business, because of some of the body mechanics. Those are some of the things we want to correct. This right here, I would sit there and say is actually pretty good body mechanics. He's got, it's not a tripod because there's no monopod, okay, on that, you know, sitting up and all that stuff, where his back, rather than taking that off, trying to sit there and lift that lens and hold that, which would be basically poor body mechanics and stuff on that. And then basically just the back trauma, okay, that things you're just going to get in and out that you can't really fix on that because of certain injuries or certain positions that you're put in and stuff on that. Okay, go ahead. Just kind of just hit all these and we'll just go through them and all that stuff. Oops, there we go. Okay, this one we don't have to really deal with much with the low back fractures. If we're dealing with that, then it's usually that's that pain that just won't go away. Okay, it's debilitating, and that's kind of the red flag to sit there and go in. 85% of all back pain gets better on its own after 2 months. I worked at a back clinic here right out of school called the Spine Center, and you know, it was one of the selling points we would tell everybody. Our program was 6 weeks long, because if you did the math and said, hey, if all back pain is going to get better, we got a pretty good chance to get these guys better. Now, you know, with PT visits, we can't see them 3 times a week, because in 2-3 weeks we won't be able to see anymore. But if we extend that and do 2 1 week, then 1 week, then 2 1 week, we're going to have great results on that. And it is 85% of all backs will get better on their own. Okay, with those back fractures, that's not going to be the case. That's just going to stay put, and you need to see medical attention on that. Most of what we have right here is the low back muscle strain. Okay, and then obviously dealing with the herniated discs. And the acute side of it is basically, hey, I picked something up, I've twisted, I jumped out of the way, I got rolled over, and boom, I've had it. Okay, what we deal a lot with when we get the chronic side is that I've had a bad back all my life. And no matter what I do, it causes me to just take a while to get going in the morning. And so the stretching program that you guys are on and all the preventative stuff that you guys should be on will definitely help with that. Treatment of that, you know, drugs. Okay, the NSAIDs, anti-inflammatories, heat, ice, the things that we've talked about. You know, my dad called me 2 weeks ago, said, I've been in bed for 2 days, I don't know what I did, I can't move. My back, overweight, not in the best shape on that. And I said, well, you can either stay in bed for 8 weeks, okay, and it will get better on its own, or get in, get some drugs, get some things to kind of calm those spasms down and do that. And he chose the latter, and you know, it's slowly moving around. And obviously the herniated discs, okay, there's theories behind that as far as if we can fix the discs. I had an L5-S1 disc when I was in college. They wanted to operate on it. Luckily, I didn't have insurance, okay, or I probably would have had the point of just operated on it, and then it's been, I don't know, 20 plus years right now. I have not had the surgery, rehab, core exercises, doing the things you have to do to maintain that so you don't sit there and have those issues with that. But, you know, if you do have a herniated disc, a lot of it will depend on the type of pain that you're in and what you can and can't do. But there's exercises, and I put some in the back of here, that are just basically the basic exercise that you think, gosh, this is all I have to do. And it's basically true. If you just do those exercises every day and keep what we call our core strength and core tighter on that, then you're going to prevent a lot of these different injuries, and you're going to have a lot of these pain and these different symptoms reduce on that. And I'm not here by at all means to kind of tell you exactly what to do and how to do it, but it's a pretty simple process. If you just spend a couple minutes, and those exercises will probably take you 10 minutes to do, your back, the longevity of it will be astronomical with that. The problem is we let things go, and we're always doing the lifting, and our arms are staying strong and our shoulders are staying strong on that, but we forget about what's most important is basically what our back is on that. Go ahead and go to the next one. Okay, these are just different conditions that we deal with on that, just not neat. We won't talk about that here just time-wise. Okay, here's just some of the stats. 33% more to standing, so sitting is what you don't want. If you have to be sitting in a long period of time, get up, move around, walk around, get that blood flowing again, get those muscles going on that. The technique on that, you know, we've all been taught the technique on that, and I don't know any of the technique as far as what you guys, but you can tell when the positions that you are in that are good and the positions you aren't in are bad. Unfortunately, we have to be sometimes compromised and put in those different positions, and that's what we just have to do. Biomechanically, okay, lifting techniques, you know, I think most of you guys know those, lifting with your legs, not with your back, just kind of what I talked about earlier, just that 45-pound bag and bending over and picking that up, putting up to, you know, upwards of 1,200 plus pounds of force on that L5 S1 disc, which is astronomical. None of us here could lift the 1,200 pounds, but yet when we pick up that weight and we put our back in that compromised position, those are the forces that are being translated on that, okay? This is the big key right here as far as strengthening the abdominals and low back. Some of those basic exercises right there will do it, okay? You don't need to do hundreds of sit-ups to maintain that, okay? We don't walk around always flexing our abs, okay? We're not the chicken on that, so, but not that abdominals aren't a bad thing on that, but you can do different core things on that, which will sit there and do it. The big question is, when do I ice, when do I heat? Okay, right after an injury, we always ice, okay, because you have that inflammatory process that comes, which is good, but which is bad too if it gets too much on that. If it's a chronic injury, then I always tell them, hey, relax those muscles, put the heat on it, and you'll be good and stuff on it. Can I use both? For sure you can use both. What we don't want is to put heat or you hurt your back, jump in the hot tub, get the inflammation, get that swelling after that first day, and that just takes a lot longer to kind of get better on that, okay? So these are the same ones that are on the back of your paper, just a little bigger so you can kind of sit there and see them. They're all pretty self-explanatory. They all take about 30 seconds each to do. Make sure when you do one, you do the right side as well as the left side on that. I think they're pretty well self-explanatory on that. Jump on, it's amazing. You get on the internet and find, that's basically where I found all this stuff. Put it together, and, okay? And when in doubt, if you can somehow get your boss to put a massage, you know, if Massage Envy was called something regarding with dinners or something like that, and you can turn in a dinner receipt for 60 bucks instead of a massage receipt, then that, for sure that will help on that. Okay, any question on the low back? Because I'm going to talk a little bit about that Mark said too with a lot of the tennis elbows that you guys get, elbow problems on that, okay? I don't, does this stuff even exist? Is that just superimposed? I don't know. I got thinking about this. I have seen these guys, Jaron and Mark, run around with 4 different cameras, but I don't quite understand why. I got one camera and it does me just fine, but and it's probably about this size right here, but it's amazing, and they've got stuff set up and things. I don't know. This might be just fake stuff. I don't know. It's what do you do at 10 o'clock at night when you're looking for pictures on the internet? Okay. On that, just real quick with the elbow. I've just got a few minutes. Okay. With the elbow right here, what we call kind of tennis elbow and what we call kind of golfer's elbow. Okay, you don't have to worry about that with putt-putt. We're good with that. Okay, but basically what that is you have a muscle and a tendon that attaches to the elbow. Okay, and if you kind of think with tennis, if this is my right hand, every time I hit my backhand, that's what I call my extensor muscles that basically get forced, and you have that tendon that attaches off to this bone right here. So every time you sit there and pick up something using your extensor muscles, which is this position right here, that's that overuse injury right there. Our flexor muscle, okay, what we call our little league or golfer's elbow right here, is when we use our flexors. And any type of overuse things, picking up things, and I'm trying to think, okay, how much, right now, I don't know if you guys even do this, I'll push a button on my camera, I don't have to really twist or turn anything on that, but you're holding things, you're in a position in a way where you're in that constant extended position where you get an overuse thing. We get a carpal tunnel, okay, which is a little bit different. You're always doing things, keyboard, picking up things, doing different things on that. And if we have an imbalance in basically what we call our extensors and our flexors, then yeah, you're going to develop different things with that. We can kind of buzz through some of these anatomy slides. Again, there's a ton of different musculature in that. You can look at that and impress your doctor next time you run in, okay? Bursitis is that little bump right here. It's basically a tendon, and it has a little fluid-filled sac, and the best thing I describe it to my students is if you've ever seen a breast implant, okay, on TV, fluid-filled sac and all that stuff, it just has that fluid-filled sac, so as that tendon rubs away from that bone, that fluid-filled sac kind of acts as kind of a lubricant as well as a compression, and when you bang that right there, you get that big old swelling and that's when you get that bursa on that. Not too big of a deal, but if you leave that go, if you let that go, then it hardens up, and then next thing you know, it just doesn't go away on that. Okay, so this is compression, ice, pads, and you're good with that. Ligament sprains is what we kind of talked about with the medial side. Okay, we get that medial epicondylitis, or that pitcher's elbow, and then the lateral side, what we're talking about is when they just kind of quoted as far as tennis elbow. Okay, flip through that. Okay. Strains again with that acute or chronic. Did I just pick something up and hurt it? Most of the things I think you guys are going to deal with is that chronic stuff. You're always picking up your bag, you're holding the bag, you're putting things up, you're holding these heavy cameras, you're twisting things on. Any type of that overuse is what you're going to get with that chronic elbow, and that's kind of just what I went through right now. Prevention of that, protective equipment. You know, with the elbow, there are pads and different things that you can use both for the low back as well as with the elbow with that. It might not be the most conducive on that, but they do have different braces for that. This is the biggest part. This is one that we really work on, is the physical conditioning. If there's a problem, don't just keep taking drugs. Don't just keep icing it. That will help. But if you don't fix the mechanical side of it, you don't fix the why it's causing it, then you're going to be dealing with that for the rest of your life. And so we kind of dig into as far as trying to figure out that why. And if you do have a weakness of that, then just doing different strengthening exercises. And most of the times your guys' forearms are going to be good. You're always doing things with your hands. You're not inactive. Okay? And then when we get inactive, that's when we sit there and lose that. The biggest thing right here is when we do our different stretching techniques, and there's a few pictures of those on here next. Those are the ones that you're going to sit there and do. You're going to get home after a long day. You're going to feel tired. You're going to feel tight. And next thing you know, you're just going to go to bed. And all of a sudden, the muscles tighten up. The tendons get tighter. And then next thing you know, you get up and you take forever to go in the morning again because you sit there and tight. I almost tell my kids, and especially my young kids as they're growing, I would rather have them stretch after an activity than before. Warm up, jog around, and warm up that way and get the blood flowing. But if they're going to increase flexibility, it's better to sit there and stretch after an activity than it is before an activity. Your blood's flowing through your body. This is when you're both most supple through those different ligaments and those capsules and those joints on that. But a lot of times they don't sit there and do that. Practice is done. Take off your cleats, take off their shoes, and they'll go sit in the cold tub, hot tub, and be done on that. And these are just a couple simple stretches you do with the forearms that really, I mean, if you're sitting there for a long period of time and your muscles are cramping, then just sit there and do a few of those real quick and all that stuff, and then it will make a big, big difference with that. Okay, next one. Again, anything we sit there and say is a 30-second thing. 10 seconds, if you remember the old high school, okay, ready, down, 2, 3, 4, 5, switch, down, 2, and all of a sudden, coaches are running through these things on that. We have a mechanical receptor in our body that protects our muscles on that, called, you don't need to know what it's called, okay? But basically what it is if you sit there and stretch, as I start stretching, my brain's going to sense it's like, the injury, and then boom, muscles tighten because they want to protect themselves. And you've got to go beyond 15 seconds to get that Golgi tendon thing to kind of relax, to send to your brain saying, okay, this is all right, I'm not going to injure myself. And then it will sit there and relax. And so we tell our kids to go beyond 15. We kind of put it at a 30-second mark on that because if we say 30, we're probably really going to get 20 with that. And so any type of exercise or stretching exercise, we will sit at least 30 seconds with on that. And the same thing with the strengthening side of it. If you do the strengthening of it, a 30-second thing, a hold on that is going to get you enough to kind of push you a little bit. If some of you guys are in good shape and you're doing some of those core exercises and 30 seconds is like, gosh, I'm not getting shaky on this, then, bump it up to 45 seconds, bump it up to a minute. But the big thing is to keep it straight, keep the mechanical side of it, keep the biomechanical side of it correct so you're doing it right. And then it will help relieve a lot of those things. I think I'm a minute over. Any questions real quick? I'm happy. And then when you guys got to go, get out of here.
I pop my back a lot. Is that okay? Like intentionally?
Yeah. You can get hypermobile with that, with those different joints and those capsule joints. That what it is? It's a capsulated joint, and when you pop your finger, you pop your elbow, you just release that pressure. The bad thing to it in the long term is you get what we call hypermobile, and that joint will get loose and laxed on that. And that's the only thing. It's not going to hurt you, but in the long run, it could become arthritic, and that's the downside. But if you just have to sit, I get up in the morning and just go, and my ankles are good to go on that. I just can't prevent that though either. So not a bad thing, but I wouldn't sit there and force it to do it as well.
I think one of our other problem areas is wrists. These heavy cameras, we have long days. What's something we can do to help our wrists?
Silly putty, okay? They've got those little egosizer things, something in your hand just to strengthen those things. Your forearm muscles, the stretches that you do are all right here. Unfortunately, around the wrist, they're all tendons. Okay, so we got the strong forearms with the muscles, but we have a very, very weak joint, similar to the back, that we have a lot of flexion, but around there, there's no bony abnormalities to kind of protect it. And if we can sit there and say, you know, I can lift 200 pounds, my wrist can't do that by themselves, but it's putting the force on that. And so just basically strengthening that wrist, making sure it's strong, and then just preventative side, icing, NSAIDs, and all that to help with the inflammation.
What about our feet? Because you'll be on our, commencement, we could be on our feet for 12 hours.
Yeah.
And you get home and they just ache. What's the best thing we could do right away for that?
Ice, just get the inflammation out of there with that. Stretch them real good before. Untuck the sheets. Okay, we get what plantar fascia we probably have heard of, where you get that sharp pain underneath the palm of your foot, and you get out of bed in the morning, you're like, oh, get me to the shower, get me to the bath before you can get going. Untuck those sheets, loosen those sheets, and I'll even have my guys, I'll send them home with a lacrosse ball because it seems to be the best. It's nice and hard and round, and they'll sit there and they'll roll out their foot. The bottom of their foot is probably the best stretch for that. But it's moving around, and the tough thing, if you're guaranteed a 4x4 square to stay in, there's not a whole lot of moving around you can, but anytime you can keep that blood flowing, because it's usually just a pooling of blood that sits there, and you don't get circulating, so you get kind of the old stuff, the stagnant stuff that stays there, when if you could circulate around, you kind of help change that up. And then shoes and mechanical side and stuff on that.
All right, back in the old days of film, you're developing film, you're moving around, what have you. Now we spend so much time sitting at the computer. What are some things we can do to sort of counteract that long time sitting?
Good chair, okay? Postural side of it, well, you've got a good chair that you can sit up top, laptop or computer at a height that you can sit there and not bend over with that. I'm terrible at that because I lay back, kick back in my chair, and I put my laptop on my lap, and I usually do things that way because I'm in bed, and I work with it in bed, and it's just kind of a habit, and I can type better with that. But mechanical postural side of it, making sure that hip, okay, if we can sit there and find neutral right here, and this is kind of my sway butt, okay, and this is there. If you can sit there and rock that back and forth, is that looking good right here? Yeah. See, that's why I didn't wear a BYU shirt, just in case I pulled something off like that. Okay, just finding that neutral side of it where I can sit there and say, okay, I can stay right here, and this is my neutral right here. Now the core is, I got to keep that. As I walk around, I got to tighten my abs enough where all of a sudden I'm not walking back like this again. And so getting in a chair in that position where your spine is neutral, because like I said, when you sit, that comes up, and then obviously the legs come out. And if you're in a bad position with that, that's when you get that chronic back pain and aches and stuff. Go ahead.
I do a lot of crouching and bending down. What are good exercises for your knees?
Quads and hamstrings. It's usually the hamstrings that are really, really tight. And so when we sit there and do that crouching, I don't mean if you're crouching with a lot of knee flexion, but if you're coming down right there, it's just getting those quads and hamstrings tighter. Your quads are almost always stronger just because we walk forward, we don't walk backwards all the time. And so I'm doing different exercises to get those hamstrings. So when I'm crouching down and doing different things, I have equal forces on both. And all of a sudden my transition of my knee, and I don't have a knee, but this is almost like a knee, where it's not always sliding forward and stuff on that where the muscles are fatiguing. Hey, as soon as you got to go, just cut me off. I'm good till 9:30, but I know you guys got to get out of here.
Either shoulder bags or backpacks. I'm having issues either shoulder bags, the hip bags. It just moves the weight around, but then either I start getting a lower back pain, or if I'm wearing shoulder, I get a shoulder even if I'm switching. You know, the pain just kind of keeps moving around. So what would be a better place to, have your weight lower?
The best thing is to have a shoulder pad with the harness back thing. If you ever go backpacking and just carry a shoulder strap and you don't have that back thing, what you find yourself doing is what? Yeah. Going like this. If you can get that back thing, that basically all that does is just reminds you to sit there and come up. And I've even had some people put a back brace on because what is it? It reminds you to that position here. And that's all they're there for. They don't help much other than they put it on and it keeps you in this position right here. So coming up with something to have both will be the best. Keeping it tight to your back, the tighter it is, meaning the snugger it is on your back, the better. If it's flopping around, it's loose. It's kind of pretty hard to put a tight backpack on it, put it on and cinch it up so it's close to your back. It's the same thing. If I'm carrying something here that's 45 pounds, that's a lot heavier than if I'm carrying it right here and letting my spine take the brunt of it and stuff on that. So finding that probably that combination of both. And then again, anytime you can take it off on that, whether it's even for just a few more minutes to give your spine that rest will make a huge difference than saying, I'll just leave it on because I got to jump out of here in 5 minutes anyway.
Can you show the proper way to put on a camera backpack that's sitting on the floor to do it without bringing it back?
Yeah, we got one right here. So if this is it right here, and I don't know, is this probably pretty normal weight? I'm guessing probably 30, 35 pounds maybe.
Yeah.
Probably about 600 pounds right here, and I'll just show you. If you're sitting there right there, and if it's going from the floor, and I would sit there, take that, lift it up to something that's a little closer on that, and you can either come out for it from here, okay? If that's not doable on that, then it's just getting it straight up rather than getting it and twisting, which I think a lot of you guys probably do, and we all do with backpacks. You get that, and you huck it, and next thing you know, that thing is twisting on that. So it's just getting anything up, getting it up to this position here, getting it up, throwing that on, and avoid this motion right here. As soon as you get the flexion and rotation, that's when you get into the issues of having different problems and stuff. And same thing, when you're taking it out of, hopefully that's still on, when you're taking it out of your car, okay, or putting it in your car, don't reach. Get it in there, get it in your car, and if you've got to slide it, push it. And those are things we don't think of until after the fact, is that you just reach and then, damn, I shouldn't have done that, type thing. But it's usually the too late thing. But getting it loaded onto your spine, close to you, putting it on rather than taking it, swinging that, and then getting that rotational force with that.
We spend a lot of time on our knees. Can you talk a little bit about the difference? How important are knee pads and what they do?
Unbelievable. I've tiled many floors. Well, my own floors, I guess, and not other people's floors. One night, no knee pads. I bought the cheap ones. Home Depot, $4 or $5. Forget it, went back, bought the $15 ones. Unbelievable difference. I think you guys have probably forgotten them and realized that, gosh, I wish I would have had those on that. And that's going to prevent what we call that bursitis, or that knee tendon, that patellar tendon as well on that, where you're constantly putting on that. Any type of trauma, whether it's just this, is going to be issues with that. And so, I'm not on my knees, I don't do that, but as far as having them and being in a profession where, not a profession, but doing that, night and day difference on that. Not the protective side of it, but just more the repetitive trauma side of it, where you're constantly sitting on your knee for a long period of time, is going to be, well, I'd say would just be huge. And you guys probably can speak better of that than I can. In the back.
Do you see any value to using an inversion table?
Inversion table coming up where you're just sitting there hanging. Gravity is my understanding. Make sure we're on the same thing. On that, they can either go from full, where basically it's just distraction all day long. We're compressed. So put it at an angle, and they're sitting there and trying to decompress those discs on that. If you have disc problems, I think they're great. From the gravity boots on that, from traction tables, chiropractic will just actually just distract you that way on that. And the other thing they'll do too is they'll get some of that, as we get older, we have our circulation's worse on that. Our lymphatic system doesn't work as well. And as you sit there and pick up those legs even at the end of the day and let that gravity work on that, is another benefit of those tables and stuff on that. So would I go purchase one? That's probably up to you. Would I go lay down, get my feet up on that? But the biggest thing with those tables is that distraction of that decompression, of that spine. And we've used them on some of our athletes who've had those discs, and we've had actually good success with them. So,
Like a handstand?
Yeah, if you can hold a handstand for 30 minutes, that'd be great. Yeah.
Is there anything naturally we can do to kind of suppress that inflammation? I mean, where is it
It's coming from because our body doesn't get rid of it as it used to as we get younger. We all have the same different things as I mean, younger we're kind of harder on our bodies, but our body is able to filter that out a lot quicker, the different chemicals that cause a different pain and inflammation. And as we get older, it slows down. In addition to the tissue breaks down a lot quicker as well on that. So we get injured. And basically, inflammation is caused from all these little micro traumas. And so we can do different things on that. I can do 10 squats right now, and that's going to cause me more soreness because my body's getting older on that. So it's just a genetic thing. If you come up with something, you probably get out of this business and you'll be financially really, really good. And that's where all those anecdotals are, creams, pills. I get, especially this year, because I probably had 50 different phone calls of take this, drink this, smoke this, do this, whatever on that, and your guys are going to be performing better. You know, it's just not there. It's just a genetic thing on that where eventually just kind of break down. I'll end and I'll stick around because I know it looks like you guys got to get up to Salt Lake, and I'm here for another 15 minutes. And if I'm happy to just talk to you one-on-one or in a group, that's fine.